Great to have you once again, Aniti. Now, there is one debate in the market out there that quality beds are very concentrated to metros and lower tier towns and cities are being massively under penetrated right now. What's your own thought on the same, and what is it that you think could be done to try and increase the penetration in some of the smaller towns and cities?
Yeah. See, you're right in that there is a large concentration in the number of very high-end super specialty beds in the large towns, but that is true of any sort of infrastructure. There's a preponderance of all the best schools in all the big cities, all the best roads, all the best buildings, all the best apartments, all the best housing societies tend to be in the best cities because that's where people want to live. Now, there will be a crowding out effect at some point. At some point in the future, there will simply be not enough ability for the large cities to absorb any more super specialty beds, at which point it starts making sense to start investing in tier two and tier three towns. And you're seeing a lot of hospitals start moving in that direction. It's just that right now, there is still so much latent demand for patients in the large cities to get high quality healthcare, which is why a lot of the investments from our company tend to be concentrated in these areas.
So I have two follow-up questions. Follow-up question number one, lot of tier two and tier three, I would not use the word clients here, but patients would come to big cities for their treatment. Now, if those same cities are being serviced by good existing hotel chains, don't you think this could have impact on the metro brands' occupancies?
Absolutely. But it is counteracted by the fact that more people will be utilizing the hospitals that are there in the large cities as well. You have to remember that as a society, Indians, we tend to be the least likely to seek medication, the least likely to seek treatment, the least likely to visit a hospital. At most, you visit a hospital once, maybe two times in your life. Whereas in Western countries, you visit the hospital every couple of years for various ailments, whether minor, whether major. And so, yes, the need for people to travel should never have been there. There should be an even distribution of healthcare infrastructure. But being that as it may, the number of people moving across countries, across cities, across states will go down, but that will be counteracted by the number of people in those cities accessing more healthcare.
Look at the big picture, which is demand. In India, the demand for healthcare is going to grow exponentially. That's the nature of the economy in terms of healthcare need demand. But if one has to look at the category or the space in which you operate, I'm using again words very carefully. The space which you operate, I think, is premium healthcare. And in premium healthcare, what is the right way of looking at demand and supply?
See, demand is effectively infinite for all the things that go wrong with the human body and the ability for very highly trained doctors and the medicines and equipment to fix that. So from that sense, there is no upper bound on how much a person can get healthcare and recover from life-threatening illnesses. But it is constrained on the top end by affordability. As long as today 60% people paying for healthcare out of pocket, there will always be an upper bound on people thinking that this is something that they should seek treatment for. And so healthcare will grow. Yes, healthcare consistently across the world grows at GDP plus a couple of maybe 4 or 5 percentage points above that. But as long as access to means of paying for healthcare don't improve, either by people becoming wealthier or by insurance becoming more widely penetrated, there will be this upper cap on how much healthcare could potentially grow.
Now, NH has done a great job of maintaining their margins. I mean, margins have got rebooted. 23, 24% now seems to be the quarterly average, which frankly is fantastic and one of the highest in the industry. But with increased competition, with what insurance is now doing in terms of tightening their payout to patients, can a 20 to 25% margin sustain on a longer term period?
The insurance business for us is only about 20% of the total volume. For other hospitals, it is 40%. The margin compression is not going to be driven by the payer factors as much as it is going to be driven by the underlying cost structures. We are in a situation now where all our beds are adequately utilized. We have a huge amount of occupancy, and all the cost structures that we are bearing, the salaries, equipment, infrastructure, CMC, AMC, utilities, is all borne by what we have. As us and the other hospital groups start going into the next wave of expansion, you are front loading a lot of those costs. You are front loading all the cost of the new manpower, new equipment, all the new loans that you are taking on. And it may not be offset yet by the patient volumes coming in. So the drag for us in the margins will always come from competitive factors and the new infrastructure coming.
I just going to jog my memory, and I'm going to recall a slide which I saw from a PMS head on the hospital industry, and he said that this industry essentially is going through what could be called an interesting times, because the supply of medical doctors is going to be large, and there is very little wage inflation at the entry level. So can I say that at least for the Indian hospital sector per se, one problem which was doctors and nurses, that now seems to be taken care of?
In a very short time frame, yes, but that is not the case because ours are not a static environment. What will happen is in the large cities, thousands of new beds are going to start coming up, at which point a lot of poaching starts to happen in the industry. When doctors start to move around, then the average wage gets reset on a completely different level. Similarly, at the nursing level, it is highly sensitive to minimum wage price hikes, as well as the employment situation in the Middle East, Europe, US, UK. And so those always, they tend to hire in the thousands, but very sporadically. And so, yes, for maybe a quarter, 2 quarters, you can say this would be the case, but the long-term trend of this industry has one that is always pressured to find enough doctors to treat all the patients that we require.
In next 3 years, how much of NH's revenue is going to come from non-India, non-India geographies? For example, the Cayman Island property, that's one example. Apart from that, where else do you think you're likely to expand your operations?
In 3 years, we will be mostly maintaining the network that we have right now. The international patients that today account for 8% of our India-based revenue, it came down from 11% before the pandemic. That is a number over 5 years. We expect it to go down to 0 for 2 reasons. One is we're not actively soliciting a lot more international patients. 2, we're going to replace that with a primarily domestic focus. The international operations that we have in the Cayman Islands, we've doubled the capacity over there. And that in 3 years will ramp up. And as part of the consolidated basis, will account for a much larger share of our overall revenue pie. And any other geographies, there's no short-term plan to look at it, but it's something that's always at the back of my mind.
Say that in the near term, the group's attention would be, of course, expansion of the healthcare business in India. But apart from that, it is just going to be perhaps building up your insurance business, which you've launched a couple of weeks ago.
Yes. The primary focus, the thing that I'm spending most of my time on, is the wholesale transformation of our group from primarily driven by doing surgeries for patients who are literally at death's door towards becoming a fully integrated healthcare provider that takes care of patients from the entire healthcare life cycle. So that means insurance, that means clinics, that means managing people with chronic heart, kidney, liver diseases, and that means just being available for the patients no matter their healthcare problem. So that is one thing that will have a radical transformation of how our infrastructure should look, how the patients perceive us, and is a very long-term journey, but it's one in which we are fortunate to be able to take on.
So if somebody is, let's say, watching this interview, he says, okay, I want to do Narayana Healthcare and it's been a great experience. Viren and his team have done a great job, kept it asset light. They were able to build a great franchise in a tough time. But if I'm, let's say, looking at investing into the stock now, what is the 3-year promise in terms of expansion, growth, new businesses? How scalable would be insurance? What should be the proposition for an investor who has a 3-year time frame?
The thing is, our business just takes too long. The cycles for expansion, growth, and the way the business works, 3 years is simply too short a time frame. All we can promise to our investors, and that is something I keep iterating, is that our journey is not going to be a boring one. We are here to change the world. We're here to change the underlying dynamics of this industry. We've never been happy with the status quo. We've never been happy with the way the healthcare system currently operates. And we're simply not happy with the situation where all the private hospitals put together in the country are accessible only to the top 10% of the country and contribute for a very small number of beds. That's simply not acceptable to us. So ours is an interesting company that tries different things. Some may call it crazy things, but it's one in which we believe that is the direction the industry is moving towards and will lead to much more diverse set of revenue drivers rather than just being focused on just doing one thing, which is just surgeries for tertiary care.
Okay, Viren, great to have you on the show. Thank you so much for joining in and giving us a color of how the industry and, of course, as your company is shaping up.